Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to the Healthy Living edition of KUM News Extra. Going to the doctor is often a dreaded event. Some get anxiety just even thinking of having to see a doctor, while others are worried what the doctor will discover during an exam. While a visit to the clinic can be intimidating, Express Care's Dr. Jitka Lom is here to talk about how you can lessen that stress and the worry associated with visiting your doctor and how to get the most out of your doctor's appointment. Thanks, Doc, for coming in. So some people actually get anxiety from, I don't know why, to see a pretty face like you, but some people actually get anxiety to think about even having to go to the doctor. How can they alleviate that?
Yes. Well, you know, many people were traumatized when they were small children, and they can't even remember, but when they got a shot, it was horrible and awful, and they carry that, and every time they come to a clinic, they remember that terrible event. So it's hard for them. And I think the best way to deal with this is to remember that the word doctor really means teacher. And that is our job, is to teach you and to help you understand what's going on, and then help you make the best decision for you. So where you're a teacher and your advisor, and when you come with an attitude of curiosity, like, I just wonder what they're going to say, what's their opinion, what's their advice, remember, you're the boss. Nobody can do anything to you without your consent. You don't have to take any of the advice if you don't like it. And that will just bring the control and the security back to you, and you'll remember that you're in a safe place with the person who is there to help.
Okay. Now, you mentioned that it often starts from when you're younger. So, like, I have 2 young children. How do you suggest that parents with young children, when you first introduce them to going to the doctor, I mean, obviously when they're newborns, they go for their shots and you can't help it, but as they get older and they start to understand what a doctor does, what are some tips and advice for parents with young children? If
you can make a visit that's going to involve no shots, it would be really helpful, so that there's some building up of trust, where there's an interaction, a pleasant time, and they understand that this is a safe place and they're not going to be hurt, because that's the main thing that children fear. Even later on as adults, we fear being hurt or being disfigured. And those things can be helped by just hopefully having a good interaction and then coming back a second time. A simple tip that you can use for the shots is give children a little bit of Tylenol before their visit, 20 minutes or 30 minutes before they have their injection. Even as little babies, you can give them a little bit of that. A tiny bit of sugar right before the shot helps reduce the pain. And an ice pack, just bring a simple little piece of ice, put it on the arm before they get their shot. And so you're going to practice at home, put a little bit of ice on the arm first, that's all you're going to feel, just a little bit of ice. Okay, and then once the area is quite numb from the ice, they hardly will feel the injection.
Good tips. Now, since doctor's visits can often be short, as you all have so many patients to tend to, what should somebody do to prepare for an appointment? You write down a list of concerns and questions, things like that?
Yeah, be realistic. We can probably handle 3 concerns and not more at that time, okay? But come into your appointment prepared. We want to know 4 things. We want to know, what is your past medical history and your surgeries that you've had? What medications are you taking? Please bring your list, or actually just throw them all in a bag and bring them with you. Then we can see the bottles, see the dosages. It's not helpful to know it's a little white pill or some kind of cream, okay? Then we need to know your allergies. That's the next thing we need to know. And then we need to know, what have you tried in the past for this complaint, whatever it is, sore throat, hip pain, whatever. What have you tried and what has and has not worked? So you think about those things before you come into your appointment, and you bring your list with you, and you'll have a much easier time with your appointment and be able to get to the results or the advice much more quickly.
Okay, now you mentioned medications and prescriptions and bringing that bag with you. How important is it for you to know that kind of stuff as a doctor?
It's incredibly important, because many times you've tried what I would have suggested already, and I don't want you to waste your money. Or you may have had a side effect, maybe the problem, the complaint that you're having, in particular rashes or headaches or so on, they're coming as a side effect of the medicine that you're already using. So I don't want to give you more medicine, I want to take it away. So please bring your medicine with you. Another thing to do is to actually take your medicine on the day of your appointment. For example, blood pressure medicine. You're coming in for your follow-up on your blood pressure, but you didn't take the medicine that morning. I don't know if it's working or not. Or prior to a blood test, make sure that you've been taking your medicine. And if you haven't, just be honest about it too.
Okay, and so that's another thing that I was going to mention, and I was reading up on this topic, is to be honest. How important is it for us to be honest? Like, well, you know, a little white lie here and there, but in the end, it's actually not beneficial for us.
You have to completely trust that the information that is there is only between you and your physician, and we're bound by our integrity and also by our Hippocratic Oath and by law to not reveal your secrets. So whatever you're bringing in is going to stay in the room. So things like concerns about sexual matters, concerns about your private parts, worries about fears that you have, worries that you have cancer or whatever, tell us up front why you're there. Or if you're just there to get a sick note because you need that to return back to work, you can just be honest and say that. Pretty much we've heard it all, we've seen it all, you're not going to really shock us, and the embarrassment that you feel is only yours, and we're there to help you with it, not to judge you or to make your life any more difficult.
All right, one last question before we throw to break is, do you like to hear somebody say, I don't understand what you mean? You did mention just be inquisitive, I guess, a little bit, curious.
No, I love to hear that. We can explain anything if we take the time, anything at all. It can be explained so that you understand it. If you don't understand, you need to say, I still don't get it. I don't understand what you mean. I can give you a printout. I can explain it in a different way. I can draw you a picture. Don't just nod and say, yes, yes, I have no clue what you mean. We'll try not to use the big words. We just need to give you a clear picture of what's going on with your body so that you can incorporate the power of your mind to help yourself heal.
Okay, sounds good. We've got to take a quick time out, but Dr. Lom will return right after the break to tell us more about getting the most out of your doctor's appointment. Stay with us.